Good evening, viewers. Dr. Arunima Sreeletha here, Associate Professor, Department of Child Health Nursing, Bharati Vidyapith deemed to be University, College of Nursing, Navi Mumbai. So today's topic for podcast topic is update on respiratory infection. We have Dr. Note Rajalakshmi, consultant pediatrician. Madam have 20 years of experience in the field of pediatric medicine. So as we have discussed the topic upper respiratory infections, ma'am, what is the term meaning of respiratory infection for the viewers, those who are
Good,
not aware?
yeah. Good evening, everyone. The term, before we say the term respiratory infection, let us see what is an infection. The infection itself, the body is there, the physiology is there, and suddenly there is an entry of either a virus or a bacteria or a fungi or a parasite. Here, in the context of respiratory, we speak about upper respiratory passage and the lower respiratory. To understand it very simply, lower respiratory is the lungs, the bronchi, the bronchioles, and anyway, here from there above is the upper respiratory, consisting of our nose, our throat, and up to the trachea. We can say it's the upper respiratory. And the infection is entry of these organisms which creates a cough, it can create a cold, or like it can create, if it's in the lower passage, it can cause wheezing, breathing difficulties, and like that.
Ma'am, which are the most common respiratory infection which you see in your daily practice?
In our daily practice, the common most is the common cold. Following these are the regular viral infections, the respiratory syncytial virus, the influenza viruses, and the cold cough, the throat infection, the tonsillitis, the sinusitis, the pharyngitis, and gala. When the throat is kind of affected, we call it the laryngitis also. These are the common most we see. Then we see the pneumonias. Now in the COVID era, COVID luckily did not touch children much. So these are some of the common infections. Yes.
What are the initial symptoms, and when it is deteriorating or when it is like infection is catching hold, how the children manifest the symptoms?
The simplest point for the parents is, first of all, you see, is your child having fever? Is your child having cold and cough? If so, is the child playful? Or what we use a word in our clinical parlance, we say toxic looking. Toxic doesn't mean that way. It means a sick child or a well child. If it's a well child who is having this cough, cold, it is a part of the journey. Young children can have up to 6, 7 upper respiratory infections in the year. That is how they gain their immunity. And if it is going in a serious note, you see the nasal flares like this. The cough sound is more heavier, and there are chest retractions, and the child looks unwell, and fever could be raging high. And once they come into the clinic, of course, we check the pulse oximeter. That gives a good idea whether it's how much is the severities of the infection, and we can come to know by that and by the chest auscultation. We check the throat. But for parents' point of view, is your child healthy, playful? Is it a mild fever? If other activities are okay, we can consider it to be a normal. And if the child is unwell, not eating, drowsy, breathing heavy, you can consider it to be a sick child.
How you differentiate my mild infections and serious infection?
It's actually back to the previous question. In my clinical practice, most of it is by clinical examination. To make you reach to a good level of what it is, you look at the basic parameters. The activity of the child is good, it is a milder infection. If it's a little bit of a cough, cold there, fever is around 101, 100, it's a milder infection. If the child is very unwell, refusing to eat, or having severe throat pain, not eating, and not well, drowsy, passing less urine. All these are symptoms, and breathing heavy, sick child, serious infection, rough guider.
Ma'am, what kind of treatment approaches usually we give for all these kind of respiratory infection, as if you will be able to brief?
Yeah, with the ongoing hype about the cough and the cold syrups.
So this season is now.
Yeah, especially, and as we are approaching the season of the respiratory infections, the common most is to give, like, earlier we were giving combination decongestants. Now we are on single ones. In that category, we do have the cetirizine, the levocetirizine, then we are having the fexofenadine as a single group. If we must give support for the cold, but most of the time, uh, a gentle, like, nebulization, uh, without even medication, a simple saline nebulization takes care of most of the younger children's cough cold symptoms. We can support the cough syrup very carefully under medical prescription, and supportive measures usually take care, and the child recovers. If the child continues to have fever and is unwell, then we examine clinically first. If we see a throat infection proper, a pharyngitis or a tonsillitis which requires an antibiotic, we, if it is clinically evident that there is tonsillitis and it requires an antibiotic, we support with an antibiotic. The other thing in the fevers, if it is simple fevers, we wait. We give only symptomatic medicines. 2-3 days are gone by, the fever is still not better. That's the time we would like to go for a little blood parameters.
Okay.
That
blood,
is
blood parameters. What are the things we'll be looking
we do
for?
a complete count, we do a CRP, and these days the viral profile also comes to see which type of viral infections are on. Predominantly in my practice, I use clinical approach, and it works 99% of the time. Yeah.
Next, I think this is your favorite question, and you can brief well. What kind of preventive measures we can?
Yeah. The preventive measures for simple common cold can be the general environmental preventive measures. That is, we take care of the dust, keep, like, if you have pets, it's fine. We need to have our pets, but at least if we know, if we are allergic, the child is allergic, we can take care preventive measures. Sometimes the child gets triggered by the agarbatti and all. If the incense sticks and all are triggering an infection, we can avoid those triggers. Young children preferably not to be taken into the kitchen while you put tadkas and all. These are our basic and regular dusting, taking care of the pigeons around the pigeon shit around the house. These are simple measures, medical. Now, the other part of it is to take care of the immune supplements and the diet of the child. Common cold, it is all environmental trigger, but when it comes to the other kind of infections, uh, we do take care of the immune status of the child, their iron correction, well, taking care of their vitamin D and other vitamins. That definitely plays a role on how fast the child is going to recover from a given illness. So the diet plays a good role there.
Can you talk on vaccines?
I can talk on vaccines, but before that, one more point I will add for the audience. The parental anxiety which is there surrounding an illness deeply impacts the child. This is a point I would like to highlight, because I have done extensive work on subconscious mind reprogramming. Your communication, you may think the child is very young. However, when parents talk about the child's illness to someone else or to the grandparent on the phone, mindful communication is of utmost importance, because I have seen parents getting overly worked for cough colds taking the child to several pediatricians, and the child even believing that she is so sick and unwell, and the child refusing to go to school saying, I can't, I am not well. So this is one point I would like to specially point out in this context. Now coming to the vaccines, the general immunity builds with the vaccines. We have our flu vaccine. In the younger age, we do have the pneumonia vaccines. When we give the vaccinations, the cover is the immunity. The observation is a flu protects against the flu and the swine flu, but it does give a indirect response to even the common colds. This is the observation, and even it has. Though we are on the topic of infection, I would extend a point like even children who are having asthma or labeled to be having childhood asthma, even for them, if you give the flu vaccine, I've seen the benefit in these children.
Complete coverage.
Complete coverage.
Ma'am, how we spread awareness?
The awareness for respiratory infections, or do you want for everything like asthma,
like respiratory infections,
or infections?
Upper and lower respiratory infections.
Okay, if it is upper and lower respiratory infections, the general guider is the preventive measures like we discussed, we do follow it. If the child is unwell, a basic a day or a two, you can observe the fever and the cold and the cough. But beyond that, I think the approach is to take to the regular pediatrician or anyone else. If your pediatrician is not available, any other pediatrician, and consult. Uh, that is it. Like you consult, it will be better.
My final last question.
Yeah.
So, in your practice, you felt any recent changes or trend or any kind of frequency changes, or any like suppose for example bronchiolitis is increasing or laryngitis is decreasing, any kind of that trends which you can
every time there is a pattern. Sometimes we have this hand foot mouth disease with lot of lesions in the throat. Suddenly there is a series of children who come with a common cold begins, common cold pattern, viral throat irritation, and a basic cough, and then there is a seasonal increase. There is pollution, and air quality index is definitely down. It is more down in certain parts of the country and less down in certain parts of the country, but the quality of index definitely is down, and because of that we do see an increase in the upper respiratory infections.
Thank you so much, ma'am.
Thank
you for your time.
Thank
you, viewers. Hope this video will be helpful for you for the prevention and management of respiratory infection. Thank you.